Healthcare organizations all over the US are not seeing a return of patient volumes to pre-pandemic levels. Volumes are certainly higher than they were during the height of the pandemic, but they are still not where most organizations expected them to be by now. Is it a fear of COVID, a loss of insurance, or are there other reasons why patients are not returning for necessary care? Hello and welcome to HITMIC, where we explore the latest news, interesting stories, and technology trends in healthcare marketing. I'm Colin Hung, and today I am joined by Ryan Donohue, Strategic Advisor at NRC Health. Ryan presented some interesting information at the recent HCIC 2022 conference in Miami, and I wanted to dive deeper with him to get an answer to the question of why patients are not returning. Ryan, welcome to the program.
Thanks for having me. Love to join, Colin.
Now, Ryan, you and I were supposed to catch up at HCIC 2022, but of course the hurricane came in right at the tail end of that. So a lot of us had to leave early, yourself included. So we weren't able to catch up in person. So I'm glad we're getting the chance to do it today via Zoom.
We're fighting back against nature today.
Absolutely. So Ryan, give us an idea or maybe share with our audience, what were some of the things that you were presenting at HCIC? I think you were presenting with one of your clients, is that right?
Yes, we were presenting with Allina Health, and NRC Health and Allina Health have done a lot of work in this space. We presented at HCIC a few years, but this past conference was a culmination of some work that I had done with Chris Dufresne, who leads up information technology and is kind of an engagement guru on the Allina Health side. And we were building a concept around the golden thread. The idea behind the golden thread is that consumers, long before their patients, they want one consistent path to take. They want it to be straightforward and make sense, as little friction as possible. And they want it to carry them through to the beginning stages of access, all the way into the experience or experiences, and then through the end as they're paying and healing and getting through that experience. But they want it to feel like one complete thread that's been spooled from beginning to end, and of course, built around what they want.
And when you say thread, do you mean like what would be consistent in the user's mind? Is it because I'm assuming you mean more than just a consistent UI or a consistent person to talk to? What is that consistency?
That's like a mini thread within it, right? Because when things don't look right, or they don't match, or the way that people address you don't match, or the facilities are different, all of those things can kind of add to the chaos. I do think a lot of consumers, they feel like, and this is the way we started the session, they feel like in all of the inconsistency, they are the only commonality. I'm the one in the middle of this maze trying to figure it out, and all the weight is on my shoulders, and I'm already sick. That's why I'm here. And so I don't want to manage this extra layer of stress. So what we meant by the golden thread was this feeling like you are on a path and someone has built that for you, designed it for you, is curating it and guiding you along it so that, things are generally consistent, but you also feel supported. You feel like you're in the right place. You feel like you're kind of going where you need to go with, of course, the aim that eventually you will be well again and get back to who you are, which is what all patients want.
You almost make it sound like it's like almost being with a tour guide, right? Or somebody kind of shepherding you through a series of places that, yes, you aren't the first person to be here, but your journey is unique, but we've thought about it. Like, we've thought about the payment process. We've thought about the intake process. We've thought about all the things that happen when you're on site. Is that kind of what you mean, that there's sort of this thoughtfulness that's been put to all of this?
Yes, the thoughtfulness, absolutely, Colin. And it's interesting the way you say it, because I think every patient would love to have another person who kind of hooks arms with them and walks them through every process, takes them to every appointment, helps them with the bill at the kitchen table at midnight as you're sorting it out. Of course, we know that that's not functional. It's not available in healthcare. But my co-partner, Chris Dufresne, he talked about that. He talked about how at times we need human interaction. At times, if it's really well thought out, digital interactions can help you if it's a quick, easy way to schedule an appointment that gets you on your way without a person-to-person contact. And then when you're there, having someone at the front desk who greets you by name instead of just asking for your insurance card, that's really important too. But you've hit the nail on the head, making sure that those things are designed together in sequence and giving the patient what they need when they need it. That's the most important piece of this, to feel supported.
And why is this more important now than ever, Ryan? Like, why is it important to have this golden thread and this consistency across this experience?
It's interesting. I think every presenter at HCIC would say, my topic is the most important now more than ever. And you have to sort through that, Colin. But, what I think is interesting is a lot of people are reemerging. We're doing this in all facets of life, but we're doing it in healthcare. Thankfully, people putting off care before are coming in now. And as they're sort of reintroducing themselves, we're reintroducing ourselves to them. And so there's an opportunity to make a break from things that weren't working before or during COVID. And there's an opportunity to say, hey, we're here for you now and in the future as we all kind of pick the pieces up and get on with our lives. So I think there's a timeliness to that. I also think healthcare is incredibly important and it's not getting any cheaper. And so those traditional cost pressures, if I'm really going to spend my money right now and my money doesn't stretch very far, I am expecting the best. And those expectations have only gone up. Healthcare, what do you got for me?
I want to pick up on something you said there, Ryan, because we have heard recently from a few providers that volumes have not returned back to where they were pre-pandemic, and that although there is indications that slowly recovering, there's still a big population out there who are continuing to put off care. Is there anything that you're seeing in the data that NRC collects or the studies that you've done that give an indication as to why that might be happening?
It's interesting. We're hearing the same thing. And we recently had Mike Slabowski, CEO of Trinity Health, on the Patient No Longer podcast, aptly titled Patient No Longer, because he was talking about, hey, patients haven't come back as quickly or in the numbers that a lot of health systems anticipated in 2022. So we're hearing that issue across the board. There's other partners. Kaufman Hall's done a good job of quantifying exactly how far below expectations those patient returns have been. So utilization it's bounced back. It hasn't bounced as high and as strong as we wanted. The reasons are many. We have been studying people who put off care. We call them deferrals. People who are saying, hey, I need treatment, necessary medical care, and I'm not going in. We started that way back in 2008 during the Great Recession, and a quarter of the country was putting off care. Right now, in the fall of 2022, we've got 27% of people saying, I'm not going in. It's a terrible thing. They need to be going in. They've identified that, and they're not going in. Now, in 2020 and 2021, it surprises no one. The reason was largely COVID. But we found COVID as sort of a cover for what was the most popular reason before. And now as we emerge from the pandemic, and that is financial concerns. I don't know if I can afford this. I don't know how much it costs. I just want to try to put it off. And maybe I can manage it on my own. And maybe there'll be a perfect time to take the afternoon off and go to the doctor, but it doesn't happen. And so even with COVID receding, we're seeing people say, hey, the money is an issue. I'm not sure I can go in. This time of year, especially, Colin, it's late November. I haven't hit my deductible perhaps because it's 6, 8, 10,000. It's impossible bar to meet. Maybe I'll wait till next year and play the deductible game then. And of course, we know the risk is the more you put off care, especially worried about finances, the more likely you are to have an emergency situation. And that's the most expensive way to go into a health system is through the ED.
Right. The longer you leave it, the worse the problem gets, right? Like it's
exactly.
Health problems don't get better with time, usually.
They tend not to. And we're no expert on it. We think we can be. We have Dr. Google, but we're no expert.
That's right. Is there anything that organizations can do to maybe spur these folks to come back in, or at least take a second look at this?
So we've very valiantly distracted our marketing in the last 2 years to divert people to making sure that they stay home and stay safe, social distance, get tested and get vaccinated. You still go to health system websites and they all look like they were designed by the same company, right? There's always the vaccine. Sometimes it's to the left, at the bottom, or it slides down from the top. What health systems need to do, and we're starting to encourage our clients to do this, is to start to go out on that branch a little bit and say, listen, it's very important for you to get tested if you think you have COVID, to get vaccinated if you haven't or need a booster. But we also do some pretty good things and we offer services and you should come in and use that. So I think we need to sort of start back up our marketing machines in a way that is promoting what we do, differentiating against competition. It's got to strike the right balance because we're still unified against COVID. But there's an opportunity emerging to say, listen, we're a pretty good health system and we want you to be our patient. Come in. And that's something that's been on hold for nearly 3 years.
It sounds like there isn't sort of a fear of COVID anymore, that it's more than uncertainty. And so, I also have seen a lot of websites are putting out messages say, hey, our systems are safe. We've done a lot to keep it clean and sanitized, which again, as you said, it's an important message, but perhaps not the message that's going to flip the switch inside a patient to say, I need to come back.
That's so true. And we always lag a little behind in healthcare. I think we finally got our messaging out and got it really honed. But you think about the airlines, they were doing their Clean Plus and all of their safety measures in the throes in 2020 and 2021. Now they're saying, hey, you need to go on vacation, right? And so I think in a lot of ways with healthcare, we need to catch up a little bit. We have to be cautious, especially because of what we do. And we're, at the point of contact for COVID and treating it. But I do think there's an opportunity now to say, listen, there's some people that are putting off care, and that's bad. In some households, that's a health emergency. And so we've got to ensure those folks know that we are here, we're ready to treat them. They may not be afraid of COVID anymore, but they have other fears. We should try to address those and get them back in where they need care as soon as we can.
Ryan, I could probably talk to you all day on these topics. It's so interesting, and certainly, would encourage our folks to go and look at some of this great survey and other information that you have. That's actually my last question. Where can people go to find out more information about what we're talking about today?
They can, of course, find it on our corporate website, nrchealth.com. And if you like cruising corporate websites for a long time, kudos to you. If you just want to check it out briefly, that's great. But we also have a podcast called Patient No Longer, and we have a book called Patient No Longer that we wrote during COVID, which is an interesting time to write a book. So you can just Google Patient No Longer, find a lot of that content, and you can find me on LinkedIn, Twitter, all the socials, if you will.
Ryan, really appreciate all the great information you shared with us today. Appreciate you being on the program.
Hey, thank you for having me, Colin. And this was fantastic, unfinished business from the hurricane that we could finally check on. So I appreciate you talking to me today.
I am so glad that we were able to make this happen.
I am too. Thank you.
I want to thank Ryan again for being on the program. It was so much fun having that conversation with him. And if you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review on iTunes, YouTube, or wherever you're listening and watching this. Also, head on over to hitmic.com to access free resources, get tips on healthcare marketing, and connect with PR, communications, and marketing professionals. I'm Colin Hung. Thanks for being here.